Dr. Michael MacKenzie, family physician and palliative care consultant. When my wife and I finished, so I graduated in 1980, we wanted to raise our family. We had 2 kids before we moved. We didn't want to live in the city. So I was looking for a place to live, raise our family, practice medicine in a rural setting. And we also wanted to have a good educational opportunity for our kids. So that meant in Nova Scotia, kind of Wolfville or Antigonish. So we went to both places, and when we came here we felt very welcome, and so we decided to give this place a shot, and 38 years later we're still here. It's the only place I've worked. I don't have a whole lot of other places to compare with, but that feeling that we were welcomed and that we were appreciated has never disappeared. And so we were both greeted warmly when we came, and we've been treated very warmly all of that time. So it's been a great place to work. There's a lot of collegiality here, and the hope that we had that our children would have a good educational experience and have a great place to live and grow, and that my wife would have a great place to live and grow, all of that turned out to be true. If you were looking for a place that wasn't a city, but you wanted to practice medicine in a place that had lots of support, internal medicine, surgery, pediatrics, plastics, ENT, that kind of thing, a great group of collegial family docs to work with, then you'd be hard-pressed to do better than this town. And of course, with Cinevex University being here, if you said, well, I need cultural events, there's live theater, there's hockey and football and soccer and basketball at a collegiate level. So you can do other things than practice medicine should you choose to do that. So that's always been great. One of our sons played basketball at Cinevex on the varsity team for 4 years, and that was a tremendous experience for our family just to be able to go to that. Our other son swam competitively. Our daughter played soccer, and those kinds of things were available to our kids growing up. One of the things I would mention is how thrilled I am. We go to reunions, and my family's, our friends talk about their 40-minute commute back and forth to work, and I'm at the other end of town from the hospital. It's a 3-minute commute back and forth. So I haven't spent much of my almost 40 years in commute, and that can be over a career, a huge chunk of time. Yeah, no, it's been great. I don't have any, I have nothing but praise. I did a number of years as the chief of staff, so I would travel across the province. I was always glad to come home. Whatever little problems we had, there seemed to be lots bigger problems elsewhere.